Welcome to Diabetes Primetime, everyone. On tonight's episode, we're going to talk about how to manage the things about diabetes that drive us crazy. Our guest is psychologist Dr. Susan Guzman, and we're going to be covering common issues that are real challenges for lots of people with diabetes. Before we get started, though, tell me where you're watching from tonight, and what about diabetes really frustrates you? Hopefully, we'll cover a lot of those things on the show tonight. Susan, thanks so much for joining us tonight.
That's my pleasure. I'm happy to be back with you.
So I think the number one thing that we hear from people with diabetes is that the numbers are really frustrating. Sometimes they're high, sometimes they're low. There are so many things that impact them. So I have a few questions for you about managing the frustration of the numbers. Are you ready?
Yes.
All right. So first one, what would you say to someone who says, I'm trying to make good decisions, I'm eating better, I'm taking my meds, I'm being active, but my numbers are still higher than I want them to be? How do we manage the frustration of feeling like all our hard work just isn't paying off?
When you're putting all that work in, it can be very frustrating when you're not seeing the payoffs. But sometimes when you're overly focused on exact numbers, or like you're checking a lot or you're weighing every day, that you can get lost in the numbers, and it can feel like you're watching a snail move, and you don't really get to see progress. So sometimes we recommend that you take a macro view, a step back, more of like from 100 feet instead of right close up. So what I mean by that is that you can, not that checking your blood glucose isn't important, but you can get lost in that. So really think about, is my A1C heading in the right direction? I find personally, when I'm trying to make behavior change, the one thing that you can control is what you're doing. So you don't always have a direct impact on things like numbers. There's so many factors that affect your numbers that you can only measure what you can do. So what I always encourage people to do is to think about what they're doing. So for example, are you taking your medication? That's great. So I'm doing what I can do. And then the numbers they go up and they go down. That's what diabetes does.
So I hear you saying focus on the behaviors that we do, and kind of let the numbers take care of themselves. Like focus on the big picture. Is my A1C headed in the right direction? Maybe am I keeping my weight steady, and not stress so much about the individual numbers on the scale or the individual numbers on my meter.
All right. And I understand that's easier said than done, because you work really hard to see those numbers move. But at the end of the day, all that you can change is what you can control. And that's not your numbers, it's your behavior. And so, taking your medication or trying to add more vegetables or trying to move more, those things you can measure and you can influence.
So next question, we hear this a lot. Diabetes drives me crazy because I do the exact same thing. I eat the same lunch, for example, and my numbers end up being totally different. What would you recommend to someone who's frustrated about this, just kind of the unpredictability of diabetes?
What we know is that there are dozens of factors that actually influence what your blood glucose number is, and not all of them are knowable. And so what that means is that you can do what you're thinking is the same thing 2 days in a row, but that doesn't mean your body is. And so, and you may not know what your body's doing different if you're fighting an infection, for example, or if you have a particular stressful day, that might show up in your blood glucose, and you're not even aware that it's different from the last time you did that exact same behavior.
So as you're talking about that, I'm seeing all the things that impact blood glucose as like the bottom of the iceberg. Like, we see the tip, we see food and exercise and sleep, but things like, being sick or stress, all these things that we may not be even thinking about may be impacting our blood sugar.
Absolutely. And you may not know any of that. The other thing is though that people, we tend to notice when things go wrong instead of when things go right. And so our brains are not very good at statistics. And so like if we were to keep 10 data points, so let's say you had the exact same lunch, boring as it might be, for 7 days in a row, and you checked before and 2 hours after you did that exact same lunch, you might have a weird day. But in general, you're going to see that it's probably more predictable than it feels.
So we focus on the one day rather than the 6 days where it's been the same. Okay, before we get too far along, folks, let's do our trivia question. We are doing a super cool giveaway tonight. It's for some delicious recipes for sheet pan meals. These are wonderful, easy to prepare, healthy dinner options, and you will get those recipes for free if you answer tonight's trivia question, which is, true or false, yoga can boost your cognitive function? Is that true or false? Is improved cognitive function one of yoga's many benefits? Tell us your best guess in the comments, and regardless of whether you're right or not, you will get those awesome sheet pan dinner recipes. And Trivia Tonight is brought to you by Arcray. As your diabetes health ally, Arcray helps make diabetes management easy and affordable. Visit arcrayusa.com/cost to receive a free blood glucose monitor, along with wellness materials to help simplify your diabetes management. Susan, we know a lot of people are concerned about low blood sugar and that it can be a real source of anxiety. How do you encourage people with diabetes to manage their worries about going low?
My colleague, Dr. Bill Polanski at the Behavioral Diabetes Institute, has come up with this strategy to think about it in two categories. One is actually being safe, and the other one is feeling safe, because they aren't necessarily the same thing. So being safe means that you know the symptoms of hypoglycemia and you know how to respond to it. And specifically, you know how to respond to it in a way that works for you. And so that might mean, like, sometimes when people are going low, what they do is they say, well, I don't want to waste the low having glucose tablets, so I'm going to have a candy bar, for example. Well, the problem with that choice is that if you want something to respond quickly, if you want your blood glucose to respond quickly, you need a fast-acting carb. And the fat and anything with fat and protein is going to actually slow down the absorption of carbohydrate. And so you want something that's like a pure carb to immediately bring it up. And then the general guidance is to have about 15 to 16 grams of carbs, and then to wait 15 to 20 minutes, and then to check again. And then if needed, repeat that cycle. So have another 15 grams of carbs. The problem with that is a lot of times people have had a scary experience with hypoglycemia, and they don't trust that what they're doing is going to work. And so they lose confidence in both their body and in their own ability to respond to it in an effective way. And that's when fear can take over. And what happens is people will start to do a lot of things to avoid the chance that they're going to go low. So feeling safe is a whole nother thing. And what I recommend people do, and you can do this at pretty much any blood glucose level, try it when you're in a healthy range, and try it treating. So you're not low, but if you have 15 grams of carbs and you check your blood glucose and say it's 110, see what happens 20 minutes later. Sometimes people think that more equals faster, and unfortunately it doesn't. So it's only going to go so fast. So by consuming more, it doesn't make it go faster. And a lot of times what people will do is they'll eat until they feel better. But if you can start practicing that I know what to do, and I know when I do it, it will work. Then people can really face their fear of hypoglycemia, so they're not doing those compensatory behaviors that end up either keeping them high or over-responding when they do go low.
So when we asked people in advance of this episode what was super frustrating about diabetes, quite a few people talked about just being tired of all the things they have to think about in order to be healthy. So counting carbs, getting enough exercise, taking meds, in short, lots of stuff. So how do we balance being healthy and doing what we need to do with not letting diabetes kind of take over our lives?
So just to give some perspective about that list of things that are involved in diabetes management, one of our colleagues sat in the standard diabetes education class, and she counted the number of behaviors that people were being asked to change. So that's things like you had just listed, make sure that you know what carbohydrates are, and are you paying attention to the timing about and the amount that you're taking in, check your feet, take your medication on time. All of the list of things so many things. In fact, she quit counting at 150 separate tasks. And the important thing to know is that not all 150 tasks are created equal. And what we really need to do is to be helping people think about, for their personal diabetes management, what are the top few that are going to have the biggest impact? Because the truth is, everybody picks and chooses. And given the busyness of your life and your day, you're going to pick and choose for what makes sense to you. So what I ask people to do is to just pick and choose wisely. So if you know that taking your medication on time has a huge impact for you, that might be one of those things that you consider as a non-negotiable. So no matter how crazy my life gets today, I'm going to make sure that that one task happens. So to be thinking about what really matters and knowing your diabetes, what are the things that you want to make non-negotiable?
Oh, I really like that. So prioritizing and maybe talking with your healthcare professional about what are the things that have the most impact on my diabetes? What are the things that are really important for me to focus on and really focusing on those? And, if you get to the other stuff, then great. So along those lines, in a recent interview, you recommended a coping strategy that I'd love for you to talk about. You said focusing on what you can do instead of what you can't can help you gain a sense of control. So what are some examples of how people with diabetes might use this strategy?
Again, a lot of times people are worrying about things that are off in the future, like what ifs, or they're looking back and saying why. And what we really do and our minds are kind of wired to do that so that we understand, where we've been and where we're going, but then we lose track of the now. And really the most important question that you can ask yourself is what now? And what now is something that's in the realm of what you can control. So you may not be able to, necessarily influence every number that you get, but you can control or you can influence what your own behavior and choices are. So making choices that serve you. So, thinking about what's in your sphere of influence. Can I pick that food over that food? Can I decide to go on a walk today? Can I make a choice that better serves me for managing my stress? Can I say no to some tasks that I've been asked to do just so that I can manage my stress better? So there's lots, and those things are in your sphere of influence, and they're about what now.
Oh, I love that question. I think that's fantastic. All right, next one is a tough one. We've heard from so many people with diabetes that deep down, they feel like diabetes is their fault, that this is something they brought on themselves. So when someone says that to you, how do you encourage them to reframe it? Why is this not a productive way to look at it?
Unfortunately, this is related to the stigma of diabetes, which I'm really passionate about trying to change. The stigma of diabetes is basically that you've done something wrong and now you're being punished. But diabetes is not a choice. Nobody chooses diabetes. And you don't have to take my word for it. That's what the American Diabetes Association says. And so, diabetes is not a choice, and being blamed for it makes absolutely no sense. It's not helpful. And it doesn't motivate anybody. And yet we can really internalize that diabetes stigma. And what it does, it just makes you feel bad. It's hard enough to manage diabetes for a lot of people without the guilt of feeling like I did something wrong to bring it on in the first place. How I like to think about it is that you don't give yourself diabetes. And now that you're here, there's a lot you can do to live a long and healthy life.
For those of you who are just joining us, we're here with psychologist Dr. Susan Guzman talking about how to manage the things about diabetes that drive us crazy. And we're giving away some delicious recipes for sheet pan dinners that you will get for free if you answer tonight's trivia question, which is, true or false, yoga can boost your cognitive function. Is that true or false? Put your best guess in the comments and you will get those wonderful recipes delivered to your Facebook Messenger inbox. Susan, I think many folks watching tonight have dealt with the diabetes police, those friends and family members who think they're offering helpful advice, but in reality kind of come off as critical and judgmental. How should we deal with these folks? What would you recommend?
It's not such an easy answer because it really depends on who's policing your behavior. So, if it's somebody that you feel like you can have a conversation with, like say a spouse or an adult child or something like that, then I do recommend that you actually say out loud that how it makes you feel. So, when you said, don't eat that piece of cake, it made me feel frustrated and embarrassed. And then the trick that I really encourage people to do is not just say what not to do, but to substitute then afterwards of how they can be helpful. Because a lot of times our people are well-intentioned in their policing of your behavior, but they're not doing it in a way that you're finding helpful, or you wouldn't think of it as diabetes police. So make sure that you put out a request that you would find helpful. So for example, instead of policing whether I have that cake or not, maybe you can offer to join me in a walk after dinner. That would actually be helpful. So to tell them how it makes you feel, be specific about what they did that you found unhelpful, and then offer them something that they can do that you would find supportive.
I really like that idea of kind of redirecting their good intentions to something that actually would be helpful.
There's a lot of times that you might actually, the assertive thing to do is to say nothing at all. For example, if you're at a dinner party or something, and one of your friend's spouses says something like, "I thought you had diabetes," or something like that, you might just politely nod and say, "Yeah, sometimes I get to splurge," or you might make light of it, or even though there's nothing light about it, but it isn't always helpful for either you or the other person to say much, because it's not even in your best interest to make a big deal out of it. But sometimes it really is. So you have to kind of weigh out when you think it's going to be important for you to speak up.
So taking kind of one more step back, do you have any suggestions for having productive conversations about diabetes with our loved ones in general? Talking about what would be helpful or if behaviors need to change. How should we think about structuring those conversations?
A lot of times for these tough conversations, and I'm assuming that like it's about talking about something that's more difficult, like changes need to happen and you're trying to bring it up. I oftentimes encourage people to start from a place of empathy. So like you're saying, like, I know that, like say you're trying to make your cupboards a safer place for you, but you have family members that don't have diabetes and they don't want to give stuff up. So you can say, for example, like I know how nice it is to have, goodies in the cupboard. And I can understand why you wouldn't want to give that up. And then speak for yourself. Say, but for me, that's making it really hard. So starting with a place of empathy, but then speaking for yourself. So for me, it makes it really hard for me to make healthy choices when that stuff is right there. And then again, make an assertive request. What would help me is I'm not asking you to give up all that stuff, but maybe we keep it in another place, or maybe you can have it when you're not in the home, or come up with a compromise, with whoever you're trying to talk about, your family, your spouse, your friends, but to work together on solutions.
I really like that idea of kind of framing it from the perspective of empathy, like finding that common ground and then kind of making the request of what would be most helpful for you. I think that's going to not put the other person on the defensive, which is really important.
It opens the door in a soft way.
Susan, some people feel like the fact that they're taking medications is a sign of failure with diabetes, but we've heard from so many doctors that that's not the case. Can you talk about why medication should be thought of as a tool for managing diabetes and not a sign that somebody's failed?
Yeah, that's such an important thing. A lot of times people use medication as a metric of wellness. So like if I'm on 2 medications, I must be sicker. And we actually know that in diabetes, it's a lot of times the opposite is true. The average person with diabetes will be on between 5 and 7 medications, thinking about, blood pressure, A1C, LDL cholesterol, and sometimes that requires multiple medications. And so, and that's how you stay safe a lot of times with diabetes, plus, engaging in your health behaviors. So being on medication is actually an important thing that you can do to protect your health. But a lot of times in our heads that's not true. That when we ask people with diabetes, how many of you have the goal of being off your medication? Most people will raise their hands and say, that's my goal. And what's so painful for me to hear that is that we know that with diabetes over time, we have to be more aggressive with what we do to manage it well and to keep it in a safe place. So really the goal ought to be, are my numbers in a safe place? And am I doing what needs to be done to keep them there? And a lot of times that means additional medication or different medication.
So you're really talking about kind of changing our focus, moving away from how many medications am I on, instead to what are my numbers? And, whatever I need to do to get those numbers to target, that's the most important thing, not how many meds it takes to get me there.
Exactly. A lot of times to illustrate the point, I'll tell people about 2 patients, Ray and Roy. Now, Ray, he's on 6 medications to manage his diabetes, blood pressure, and LDL cholesterol. But his A1C and his blood pressure and LDL are all at goal. Now, Roy, on the other hand, he's taking no medication and his numbers are all elevated. Who's more well? Who's sicker? And a lot of times people will get distracted by the number of medications, and that's really not the metric we need to focus on. The metric that we need to focus on are my numbers in a safe place?
So, another source of worry for many people with diabetes is an upcoming appointment with their doctor, especially if we feel like it's been a rough few months and maybe things haven't gone the way we wanted. If someone tells you that they get anxious when they have an appointment coming up, what might you suggest?
Well, this comes from a place of feeling like you failed, which is probably one of the number one sources of distress that people with type 2 diabetes report, is they feel like they failed at making changes to their behavior. They feel like they aren't doing enough to manage their diabetes. And so to want to not get that bad news or feel like you're disappointing the doctor, maybe you want to put that appointment off until you can do better. And unfortunately, that leads to people not following up and getting the help that they need. And what I say to people is you got to remember at the end of the day, your healthcare professionals, they work for you. And if you're feeling judged and blamed, that is not okay. They're there to help you manage your diabetes. This is about your life.
Susan, this has been such a helpful reframe on so many topics. Before we go, any last words you want to share with our audience?
I just always like to remind people that when you get lost in all of the challenges that can come with life with diabetes, to remember that your efforts really matter and that you can live a long and healthy life with diabetes, and it's never too late to start.
Such a good message. Thank you so much for being here with us and sharing your wisdom with us tonight.
My pleasure.
And a big thank you to everyone watching at home. Thanks for being here with us. Before we go, here's the answer to tonight's trivia question. True or false, yoga can boost your cognitive function? The answer is true. Another one of yoga's many health benefits. If you didn't get to answer trivia, but you'd like those delicious recipes, tell us in the comments what you thought of tonight's show. We would love to hear it. We will be back with you next time, Tuesday, May 11th at 8:30 p.m. Eastern Time. Please mark your calendars so you'll be sure to join us. Until then, stay safe and take good care. Good night.